When we take medicine, we want it to work quickly and effectively. But have you ever stopped to think about how medicine actually gets to where it needs to go in the body? This is where the concept of routes of administration comes in. Routes of administration are essentially the pathways we use to deliver drugs to our system. These pathways determine how quickly the drug is absorbed, where it goes, and how effectively it treats our condition. Understanding these routes is crucial for both healthcare professionals and patients. The choice of route depends on several factors. These include the type of medication, the desired speed of action, and the patient's individual needs. In the following sections, we will explore the most common routes of administration, their advantages and their limitations. From pills we swallow to injections we receive, the route of administration plays a vital role in ensuring that medication reaches its target and delivers the intended therapeutic effect. Enteral routes involve administering medication through the gastrointestinal tract. This method leverages the body's natural digestive processes to absorb and distribute the medication throughout the system. This is one of the most common and convenient ways to take medicine. It allows for easy self-administration and is generally well accepted by patients of all ages. Let's explore three main enteral routes: oral, sublingual, and rectal. Each of these routes has unique characteristics and specific use cases that make them suitable for different types of medications and patient needs. Oral administration. This is the most familiar route, involving swallowing tablets, capsules, or liquids. It's the method most people think of when they consider taking medication. It's convenient and usually safe, but absorption can be slow and vary depending on factors like food intake. For instance, some medications need to be taken with food to enhance absorption, while others should be taken on an empty stomach. Sublingual buccal administration. This route involves placing medication under the tongue or between the cheek and gum. This method allows the medication to dissolve and be absorbed directly into the bloodstream. The medicine is absorbed directly into the bloodstream through the lining of the mouth, bypassing the digestive system. This can be particularly useful for medications that are inactivated by stomach acids or enzymes. This route is faster than oral administration and useful for drugs that are easily broken down in the stomach. It provides a quick onset of action, which is crucial in emergency situations. A common example is nitroglycerin for angina. This medication needs to act quickly to relieve chest pain, and the sublingual route ensures rapid absorption. Rectal administration. This route involves inserting medication into the rectum in the form of suppositories. It is often used when other routes are not feasible. It is useful when oral administration is not possible, such as when a patient is vomiting or unconscious. Absorption is generally reliable, and it can be a good alternative for patients who have difficulty swallowing. Each of these enteral routes has its own advantages and disadvantages, making them suitable for different medications and situations. Understanding these differences can help healthcare providers choose the most appropriate method for administering medication to their patients. Parenteral routes involve delivering medication directly into the bloodstream or tissues, bypassing the digestive tract. This method is essential for ensuring that certain medications, which might be broken down or poorly absorbed in the digestive system, reach their intended target effectively. By avoiding the gut, these medications can act more quickly and efficiently, providing immediate relief or action when needed. This is often necessary for drugs that are poorly absorbed orally or require rapid action. For instance, in emergency situations where time is of the essence, parenteral routes can be life-saving. Additionally, some medications can be irritating to the gastrointestinal tract, making parenteral administration a more comfortable option for the patient. Intravenous, or IV, injection. This route delivers medication directly into a vein, providing the fastest way to get drugs into the bloodstream. The immediate entry into the circulatory system ensures that the medication can start working almost instantly, which is crucial in critical care settings. It allows for precise dosing and is often used in emergencies and for administering fluids. IV injections are also used for continuous drug administration, such as in chemotherapy or long-term antibiotic treatments, where maintaining a constant drug level in the blood is necessary. Intramuscular IM injection. This route involves injecting medication into a muscle, such as the upper arm or thigh. The muscle tissue can hold a larger volume of medication compared to subcutaneous tissue. making it suitable for vaccines and other medications that need to be absorbed quickly, but not as rapidly as IV injections. Muscles have a rich blood supply, allowing for relatively fast absorption. This makes IM injections ideal for medications that need to be absorbed within minutes to hours. The rich vascularity of muscle tissue ensures that the medication is distributed efficiently throughout the body. Vaccines are often administered intramuscularly. This method ensures that the vaccine is absorbed quickly and effectively, providing the necessary immune response to protect against diseases. Subcutaneous (SC) injection. This route involves injecting medication into the fatty tissue beneath the skin. This layer of tissue has fewer blood vessels than muscle, resulting in a slower absorption rate, which can be beneficial for medications that need to be released gradually. Absorption is slower than IM injections, but faster than oral administration. This makes SC injections ideal for medications like insulin, which need to be absorbed steadily over time to manage blood sugar levels effectively. Insulin is commonly delivered subcutaneously. This method allows for a controlled release of the medication, which is crucial for maintaining stable blood glucose levels in diabetic patients. Intradermal (ID) injection. This route involves injecting medication into the dermis, the layer of skin just below the epidermis. The dermis contains a network of capillaries, allowing for slow and localized absorption of the medication. It is used for allergy testing and TB skin tests. The slow absorption rate of intradermal injections makes them ideal for diagnostic purposes, where a delayed reaction is necessary to interpret the results accurately. Parenteral routes offer speed, accuracy, and reliability, but they also come with risks, such as infection and pain at the injection site. Proper site selection and technique are crucial to minimize these risks and ensure patient comfort. Proper training and sterile techniques are crucial for safe parenteral administration. Healthcare professionals must be well versed in these techniques to prevent complications and ensure the best outcomes for their patients. This includes understanding the anatomy of injection sites, the pharmacokinetics of the medications being administered, and the appropriate aftercare to monitor for adverse reactions. Section 4. Topical and mucosal routes, localized action. Topical and mucosal routes involve applying medication directly to the skin or mucous membranes for localized effects. These methods are particularly useful for delivering medication to a specific area, ensuring that the treatment is concentrated where it is needed most. These routes are generally used to treat conditions affecting the specific area of application. For instance, a dermatologist might prescribe a topical cream to treat a localized skin infection or inflammation, ensuring that the medication acts directly on the affected area. Skin medications applied to the skin can come in various forms, including creams, ointments, lotions, gels, and transdermal patches. Each form has its own unique properties and uses. Creams and lotions are often used for moisturizing and treating dry skin, while ointments and gels might be used for more severe conditions. They are used to treat a wide range of skin conditions, from dryness and itching to infections and inflammation. For example, anti-inflammatory creams can help reduce swelling and redness, while antifungal ointments can treat infections caused by fungi. Eyes, ears, nose. Drops and ointments are commonly used to deliver medication to the eyes, ears, and nose. These areas are particularly sensitive, so the formulations are designed to be gentle yet effective. These formulations are carefully designed to be safe and effective for these delicate areas. For instance, eye drops must be sterile and free from contaminants to prevent infections, while nasal sprays often contain ingredients that help reduce congestion and inflammation. Vaginal intraurethral medications for vaginal or urethral conditions are available as creams, gels, suppositories, or rings. These forms allow for direct application to the affected area, providing relief from symptoms such as itching, burning, or infection. These routes allow for direct delivery of medication to the affected area. This targeted approach can be particularly effective for treating localized infections or conditions without affecting the rest of the body. Topical and mucosal routes offer targeted treatment with minimal systemic side effects. This means that the medication acts primarily where it is applied, reducing the risk of side effects that can occur when medication is absorbed into the bloodstream. However, absorption can be variable, and some medications can cause local irritation or allergic reactions. It's important to follow the instructions provided by healthcare professionals to minimize these risks and ensure the best possible outcome. Section 5. Inhalation, breathing in relief. Inhalation involves delivering medication directly into the lungs through breathing. This route is particularly effective for treating respiratory conditions like asthma and COPD. Asthma inhalers. Inhalers deliver medication in the form of fine mists or powders, allowing for rapid absorption into the lung tissues. This provides quick relief from asthma symptoms. Anesthetic gases. Inhaled anesthetic gases are used during surgery to induce and maintain unconsciousness. These gases are administered through a mask or breathing tube and have rapid systemic effects. Inhalation offers rapid onset of action and targeted delivery to the respiratory system. However, proper inhalation technique is essential for optimal drug delivery, and some inhaled medications can have systemic side effects.